We've gone through some really difficult trials in our lives, and there was always somebody there with like an outstretched hand that has helped lift us up. We find it kind of almost incumbent that we provide those same lifting hands when the opportunities arise.
We decided to give this gift because it's really personal to us. 12 years ago, we found out when I was pregnant with my second child, our first son, that he had a kidney issue. It's called posterior urethral valve. His kidneys didn't function properly, and at my 20-week ultrasound, they told me that he probably wouldn't live much beyond birth. So I carried him full term, gave birth to him, and he lived 33 hours. As challenging as it was, we really feel motivated to help others who have to experience something similar.
Fetal intervention is the act of actually performing a procedure on the fetus while it's still in the uterus. The road to intervention requires a lot of infrastructure. It's coming up with a multidisciplinary team, so experts from multiple fields that can not only help diagnose, but also treat and then ultimately care for that child in the long run. In Utah alone, there's about 50,000 live births a year. And if you look at about a 1% severe birth defect rate, that would be about 500 children. And so we hope that the Fetal Center will actually be the command central for these parents.
We were doing the usual ultrasound, and I was talking to the technician, and the technician actually stopped and just let me know that there was something wrong. They know what it is. They call it CPAM.
Which is basically a tumor that's on the lung.
When we met with Dr. Fenton, he did recommend doing steroid treatment, which was successful for Noelle. He did expect that when she was born, surgery either then or surgery later down the road. 3 months later, she did have surgery with Dr. Fenton, and she did wonderful, and Dr. Fenton did amazing with her.
We know the diagnosis of a high-risk pregnancy can feel overwhelming. The new Grant Scott Bonham Fetal Center is part of Intermountain Healthcare's primary promise to create the nation's model health system for children. Brad and Megan Bonham's leadership gift goes far beyond bricks and mortar. The Grant Scott Bonham Fetal Center provides the community with life-saving treatments and care coordination to expectant mothers and their unborn babies.
What the Grant Scott Bonham Fetal Center kind of represents to us is hope. Through some support from our foundation, other families could look forward to kind of a normal life with their kids that are facing kind of really challenging medical circumstances. We seek for opportunities at the Fetal Center to provide these families with opportunities that haven't existed.
I want to extend a heartfelt thank you to Brad and Megan Bonham for their incredible generosity. Their leadership support will rewrite the life stories of untold numbers of children.